to make sure it's safe. Now, a lot of you are probably thinking to yourselves, what about those long-term bad effects, like people who have Guillain-Barré syndrome after a vaccine or who had some sort of neurologic problem? Those can last a lot longer than 8 weeks. And that's true, but they all started within the first 6 weeks. And so what we need to do is follow people for at least 2 months to make sure that they're doing okay and not having any of these serious adverse effects. That's what we're talking about. We're not talking about having an sore arm after the vaccine or anything that the vaccine is intended to do, like create immunity. And we're talking about adverse effects that the vaccine is not intended to create. There were none in the trial for the mRNA vaccines. In either the Moderna trial or in the Pfizer trial, there were none. There were more people who died in the placebo group than died in the vaccine group. And even in terms of things like heart attacks or things that nobody thought would be related to the vaccine, but you have to watch out for anyway, there just weren't any problems. A couple of people did develop Bell's palsy, which I don't think I would call a serious adverse effect because they all resolved. And there were actually more cases in the placebo group than there were in the trial group. But those sort of neurologic things are things we're always looking out for. You did hear about a couple of trials being held for short periods of time because of things called transverse myelitis, but those are different than these drugs. And we don't know exactly what happened with those because that's part of the AstraZeneca, which we haven't approved yet in the United States. They were not part of the Moderna and Pfizer trials, which are the 2 mRNA vaccines that are currently approved. So it's important to know that we feel really confident that these vaccines did not cause any problems. Now, the next question you should ask is, but how many people did you try it in? We tried it in 40,000 people each vaccine. A lot of people got this vaccine before we asked anybody from the general public to get it. And we followed those people, not me personally, but the people running the trials followed those people, and they're still following them because we still need an answer as to how long it lasts. We just don't know that yet, and we didn't need that in order to make them available to people because it's so much more important that we actually end up immune. So there's a big difference between serious adverse effects, of which there were none associated in the trials, and then side effects. And a lot of you have been hearing, probably from your other healthcare worker friends or on Twitter or on the news, about people feeling pretty nasty after they got their second dose of the vaccine. Some people feel sick after their first dose as well, but the vast majority feel yucky after their second dose. The truth is that it's about 20 to 50% of people have significant symptoms after their second dose. But those symptoms are not a bad reaction to the vaccine. Those symptoms are the actual effects of your immune system being pushed to do a training exercise. Imagine it's like if you training for a marathon, you're gonna get sore muscles. Same thing. If you're training your immune system to fight off something as nasty as COVID, you're gonna get some soreness in your arm, maybe some fatigue. A lot of people have a little bit of chills, but everybody is better within 36 to 48 hours after the dose. And most of those symptoms don't even start until 12 to 24 hours after the dose is given. So we're talking about 12 to 24 hours of not feeling your best as an investment in training your immune system to fight off COVID, a disease that's killed so many Americans. It's almost as many now as we lost in the Second World War.